Today, I'm joined by Dr. Dom Pimenta, CEO of TORTUS, and Julian Coe, Director of Exon Health, to discuss their partnership to expand deployment of assistive AI technology across UK primary care. So, Julian, Dom, thank you very much for joining me. And should we start off with some introductions? Can you both briefly, very quickly, introduce yourselves and your companies and what you do?
Oh yeah, sure. Hi, I'm Dom. I'm a doctor, cardiologist. I worked in the NHS for 16 years, was in pharmaceutical medicine for a couple of years, and then ended up in AI academia, learned to code, learned to do a bunch of research, decided I liked the AI side as opposed to the academia side, and then founded Tortoise 2.5 years ago, kind of with the thesis that AI plus doctor is a new type of healthcare system, and we're sort of starting to see what that might look like now. And yeah, that's what's brought me here today.
Fantastic, thank you very much. And you, Julian?
Hi, Harry. Julian Coe, Managing Director of Exon Health. I joined just over 2 years ago now to help the businesses scale up. I've been involved in a variety of businesses previously, so I don't have Dom's medical background. I'm an accountant by training. I've done a lot of work in lab diagnostics and two previous businesses, suppliers to the NHS, both in the mental health arena. And that was part of the attraction of joining the Exxon team 2 years ago.
Fantastic, thank you. And I guess it's worth starting off by asking, how does this relationship work? What is the headline here of this partnership that you two have fostered between your companies?
I think it's a perfect match, and so far in the honeymoon, it's a very happy period for both of us. We've been speaking for over a year about the combination of our respective skill sets and how they come together. So in terms of the perfect match, we've been very much admiring the work Tortoise have been doing. It's very important to us to work with somebody who's got the clinical credentials and the attitude that Tortoise have. We've admired what they've been doing, and to be frank, we were too late to the game. We don't have enough clinical expertise in our business with its telephony background to start and to join the race and to join the party. So we felt it was a really good fit partnering with Dom, because we have the presence down on the ground, and we think a great platform with from our telephony basis to put the two skill sets together. So that was very much how we saw it from our end. But
do you want to expand a little bit on that presence that you got on the ground, because that is where this sort of partnership comes into play? You've both got there's both big things that you bring to the table, and for you guys, a lot of that is to do with the spread that you've got on the ground. You serve a lot of GP practices, don't you, with telephony services?
Yeah, so Exon's background is the telephony product, Surgery Connect, which over the course of quite a long time, well over 10 years, we've been involved in the market and developing a specific product for GPs. We're now a team of over 140, just working in the GP market. We do everything from, I like to say, from soup to nuts, not a very technical phrase, but there are our data centers, our software, our support. We do that all the way through, and by focusing on the market, we believe we've delivered the best product. With the recent funding things in the market, we're now in a position where we're serving over 3,500 of the surgeries in England, with an advanced cloud-based telephony platform that's ideally suited, and with our development skills in-house to bring in the likes of Tortoise's ambient scribe technology to. So it's really a harmony of the two things, us providing the integration into greater suite of products in front of the GP surgery to make GP practitioners to make their life easier, whilst bringing the fantastic quality of the Tortoise scribe to market. So it's really from that background where we're very comfortable working with so many of the surgeries in the market that we can make Tortoise's products available to far more people.
So how does Surgery Connect currently work with GPs and clinicians? We'll talk a bit about the workflow here, and then we can bring in Dom and what Tortoise is bringing to the table with their assistive technology. So how does it integrate into practice at the moment, and what's the workflow like?
So we like to say we're more than a phone system, and that's rapidly transpiring. But pretty much the background is from telephone, so most people are very aware. We're all aware as individuals of the 8 a.m. scramble, the 8 a.m. rush, getting on the phones, getting people in. So Surgery Connect was helped to develop and manage that. Its core strength was very early integration into the clinical management systems, into EMIS and TPP System 1, and building out specific functionality to help GP surgeries from there. Increasingly, it's going to be about the outbound as well, and helping automate outbound proactive care for people and contact. So the move to a uniform communications hub. And that's where we start, because we've got the ability to put software onto every GP desktop, and a face-to-face consultation is no different to an outbound telephone call. We're looking to integrate the scribe into our phone bar, the toolbar that we have on GP desktops, so that whether it's a phone call or a face-to-face consultation, that can be transcribed and filed to the record immediately there, saving time and effort. And then it also opens up lots of opportunities for us to put the scribe functionality in other parts of the workflows. So whether it's reception of calls coming in, or transcribing, summarizing, and coding voicemails that you might want to use, for example, on a prescription line, or different parts of the workflow. So we see great opportunity to deploy the technology at the different stages of the workflow, whether inbound or increasingly on outbound.
Thank you very much. And Dom, do you have anything to add generally to what Julian's said there about the integration of the technology itself?
Yeah, I just think we've done quite a few partnerships in the past, and I have to say, like, again, it sounds like a dating show. We've not ever found such a good partner, and the reason, I think, I've thinking a lot recently about why, and I think if you take the forward view of where we are in 5 years from now, every clinician-patient interaction, every conversation, which is the fundamental unit of any healthcare system, is that about 100, 150 things happen in a single patient-clinician consultation. Every single one of those, 200 million a day in the world, will have an AI element to it, somewhere embedded within that system. So when we first started working with Exxon, I was like, well, actually, here's 40 million interactions happening on a monthly basis, right, with clinicians. And in some I do include the receptionist in that workflow, because it's such a core part of the primary care access and how you get into the equity. So I think we saw a couple of things. We saw a really good dovetailing of his infrastructure. Here's a really forward-thinking company that's, as Julian said, massive distribution. But I think more importantly is like committed to making the interaction as good as possible, like the access to care, the outbound access to care, catching phone calls. If you can't get through to the receptionist, or you can't get through to your doctor. And it's so naturally aligned in ethos as well. I think we've done partnerships before where people brought elements, but they were kind of going in different directions. And I think that what's really worked out well is we were going to that same direction to make that interaction as good leverage, safe care for the patient and the clinician as possible. And yeah, exactly as Julian said, so TORTUS will appear inside the Surgery Connect product, and potentially actually there's multiple different ways that we can go beyond that. So we're doing like the first sort of alpha now, and working quite quickly to get that out into the world. I'm super just interested in what happens over time with AI in that workflow. How far can we expand? How much leverage can we give? And how much more productivity can you achieve? I think our core mission as a company right now is to say that every doctor does 1 unit of energy today as a human being. Right? I can do either two pairs of, 1 pair of hands. What can I do? Right. So with AI, can I do twice as much? And that's kind of our thesis at the moment, about saving time, saving admin, finding information, doing stuff. And that means being part of the systems of where those clinicians are. And what we loved about Exxon was like, there's no more fundamental part of where people are than on the telephone, as in their accessibility. It's just, you pick up the phone and you're there. And it's really interesting when technology comes along. I still have books. I don't know if you can actually see these books, but there's tons of books behind me, right? Printing press is like, what, 200 years old, 150 years old, whatever. So like, why does some technology persist? Telephone's been around what, for 100 years, maybe 60 years, 70 years, but it's still the predominant form of how we communicate. And there's something about the humanity of it. There's something about the humanity of book. There's something about the humanity of that interaction. And that's why we think actually AI plus some of the older technology is actually probably going to unlock more human to human interaction. And again, going deeper and deeper into what's fundamentally important, communication and interaction between different individuals, is kind of where we wanted to situate ourselves. So we thought this was very much a right place, right time. Okay, maybe a bit slow, but we got there in the end.
I think that builds very much on when I joined Exxon 2 years ago. The talk in the NHS primary care was about building a digital front door, but telephone wasn't actually really seen as part of that. It was all about moving to online consultation forms, which are pretty flat and unintelligent. I mean that in the technical sense, and not to be disparaging to the providers. And the discussion internally was voice is very rich data because of the quality of communication, and technology was moving very rapidly our way to take best advantage of that, because we can't help, I don't think, to Dom's point, the human brain, and we're wired to want to communicate via voice and via conversation. Very much the technology and the services we're looking to provide to enable the clinician to have more time to care, use Dom's single unit of energy, and how can we do that using automation to make things happen? And that's really key. And Dom's technology and other things happening in the market really open up that possibility up for us to provide to clinicians.
And how is this looking on the ground at the moment? Because Dom, you mentioned briefly that it's in an alpha stage at the moment. So how is this looking for healthcare professionals at the moment?
Yeah, I think the other thing that we've loved working out with the Exxon guys is we work with lots of different types of partners. But I think our favorites are the ones where it's almost like software to software. Like we've got devs, they've got clinical, we've got compliance, and suddenly there's this meshing of teams, and we're like moving super fast. So I don't know when actually this podcast will go out, and maybe we'll give you the timelines because we don't want to date the thing, but very soon, this we're very much at the build and delivery phase as a matter of weeks away now, and then what we are doing though is coming out in a safe and compliant way, and I think actually that's worth stressing. So we're getting approvals, making sure all the joint compliances are correct, even though Tortoise and Exxon are actually approved in most places independently. Even just making sure we're crossing the T's and dotting the I's on the combined offering from an information, clinical safety, governance perspective. Super important to do this properly. So depending on where you are, it might be available to you today. It might take a bit of time to get the approvals done, and we'll get there eventually. But very exciting on the ground because it's such a deeply integrated product. Loads of clinicians were already using Exxon and Tortoise together in our patch. They were downloading files and putting them onto Tortoise, which is a piece of the tech that we built actually as a debugging feature last year. We were like, oh, this is actually quite a good idea. Maybe people would like to see this. So we hope actually even by the time this goes out, we're sort of well on our way to scale up.
Yeah, just to emphasize, it's the putting the two together. We don't have to create anything. It's really putting the two products together in the most seamless way possible. And as soon as the two teams are interconnecting, putting things together, we're looking at what we can strip out to make it as easy as possible for the user interface for the clinician, and how we develop further. So we've just got to get those bits right and then go through the clinical approvals for those elements, because the clinical safety is very much at the heart of what we're doing and how we want to go about things.
So is there anything that's different about the way that Tortoise is implemented here, that you need to do some pilot studies, for example, some testing to make sure it's working in these environments?
Not really. I mean, as I said, it's probably the most road tested use case that we've ever had. One of our users is probably at 15 months of use at this point. It's done like over 8,000 primary care consultations. Really good data, really solid time saving data. In fact, about 4 minutes saved on every telephone consultation. He also recently did an audit of notes, looking at the post-tortoise notes and the pre-tortoise notes, and weirdly kind of shocked at the lack of detail before he was using tortoise versus afterwards, and hadn't actually looked back to what he was doing 2 years ago versus to today. Obviously, there's like the software side, the integrations, making sure things like authorization works, and we collect the audio right, and that's what we're kind of doing at the moment. But in terms of the validation, no, I'd say it's actually one of the most validated areas. There's a sort of product management mantra of you're building the right thing when your customers already built a worse version, right? And this already existed. People are already doing this. And we thought, oh, actually, we could make this much better for them and roll this out as a much wider offering if we can combine these two things together. So no, not from a clinical perspective, and we're quite happy from that perspective.
The emphasis is very much on the user interface and ensuring we can deliver it at scale in the combined product. So yeah, it's just a question of joining the pieces together. And when we use the phrase piloting, it's just, do you like that button? Is that bit in the wrong color? Do we remove that there? How does that work? So yeah, we're fortunate with the combined customer bases to have a wide number of GPs already very keen to get their hands on the technology to trust it, and where the teams are racing to get that out there.
So going back to the topic of scale, once your solution is deployed, are you expecting this to have a tangible impact on the experience for patients? And of course, the ideal idea of AI is that the patients don't see it. It doesn't come up, they don't see it when they go to a consultation. But do you think that this is going to make a significant impact because of the scale that it's going to operate on, for example, for reducing GP consultation backlogs?
Yeah, I mean, 100%. I think there's a few elements to the patient journey that I think actually are quite interesting. One is that the patients can see their notes. So this is new, right? In the last 18 months or so, via the NHS app, you can see the notes that the doctor made about your consultation. Now, as a doctor, that's quite revolutionary. Like, that's not something that's ever been part of the system before. What AI gives us is the ability to sort of think about that from first principles. Well, actually, if this is a shared note for the patient and the clinician, there should be a section for the patient. And in our letter outputs, for example, there's at the bottom, there's a notes for patient, and it explains everything that's in the letter in terms of terms. You can also generate notes and letters to the patient. So I think patient engagement and education at scale is going to be hopefully much better. And I think that's a massive issue from compliance and engagement and general levels of understanding. In face-to-face land, it's all about eye contact and more engagement. It's not about time saving per se in GP land. It's more about the quality of the interaction. But equally, we have seen some data about lack of reducing waiting room times and decreasing overruns. So actually, GPs are less stressed, have more time to spend with their patients, and are much more sustainable in their job. I haven't really seen evidence just yet on the sort of longer term metrics of like GP churn, sustainability, sickness rates, and things like that. But we'd anticipate increasing quality of life does have a big impact there as well. Therefore, access to care. Anecdotally, I have seen this in other areas of people using Scribe, going from managing 1 to 2 days at work to actually 4 to 5, simply because it's just much easier, much lighter, much less burden. So we hope massive impact. I mean, that's why we're all here, right? But I think
I think primary care vastly underestimate the potential patient impact. I've just seen it a few weeks ago with my wife getting results from a hospital visit, of getting a full transcript, notes sent immediately after the meeting. She went through them with me. There's no question of what she forgot or her understanding, her interpretation. And I think we just take that for granted in a lot of communication. Just because the doctor thinks they've relayed everything over, has the patient heard it? One of the previous businesses I worked in, IESO Digital Health, was cognitive behavior therapy online via chat. And some of the very tangible and significant benefits were just patients saying, I've got every word between me and my therapist. I can go back and review it and re-see it and understand it better after the session. They're only small things, and it only has to be for 10, 20, 30% of patients, that's benefit. But that's a massive overall increase and improvement. And I think one of the things that will come through not long after the GPs themselves get hold and used to using the tool is understanding the patient impact, which is not necessarily always first and foremost in their thoughts. But as patients, we go into the doctor, how much do we ever hear of what they've actually said, and do we understand it? And having written notes around it available literally now at the click of a button, that is with the accuracy and quality that they have to take away, to revisit and to review, I think it's a small but really important thing that GPs are going to learn to embrace and I think really treasure. But it's a different world when everything is getting transcribed, put down, and understood, and it needs to be embraced, I think, for the benefit of the GPs and the patients.
Yeah, I think that patient empowerment is a really good point, actually, and something that I think we've seen in the work that we do, looking at across the market and the developments that come out, is the importance of patient empowerment. And even as you said, it's easy to forget what you've discussed. If you had an hour-long consultation, it's very easy not to remember what's happened in that consultation, and perhaps your follow-up might be months ahead. And being able to have that at your fingertips, to be able to access all of that information, it allows patients, especially if they're moving between institutions, for example, where they might not have access to their previous records, then it gives them more power to sort of inform how they're receiving their care. So yeah, I think that's a very important.
It's like anything. As a patient, if you've been referred through a few pair of hands, as naturally happens with the thing, I told the doctor this. I told the second person that. You end up with a concise summary review to the person at the end of the chain who's then to help you. You've told 4 people this already, so it's a very natural thing. And I think one of the again, the holy grail in the industry is share cared record of things getting passed on. We don't need long as professionals on the other side to scan notes to know what the important thing is in there, but it's much easier to distill down the detail than it is to create it. So I think there's great opportunity in there when everybody, both sides, embrace what's available.
And also, I would just also add to that, like from a clinical perspective. So once upon a time, the company was TORTUS. Actually, the product was called Osler, and it was named after William Osler, who very famously said, "Listen to the patient; they are telling you what is wrong." Right. And what he meant by that was actually the diagnosis in 75%, and this is as true 200 years ago as is today, is from the history that the patient gives you, not from the examination. That's like 15%, and actually not from the blood tests and the imaging, which is where most lay people think you'd get most of the results. Most of the time you go to the doctor, you don't get a test, and therefore a decision has been made prior to that, and that's completely in line with the literature. Even from as late as 2012, there was a paper that confirmed that. But the problem is the system doesn't give any time to listen to patients. So if you have a very complex history, anecdotally, a friend of mine, very complex history, acute unwell, ended up seeing about 40 doctors. That's not an exaggeration. 40 doctors across multiple different settings, super sick. And what was the thing that actually made the difference was my friend collated all the information, had a diary of symptoms, and then had AI summarize it and say that here's a concise summary of what's actually happened to me. And when you read that, you're like, this is the diagnosis. You don't even need to actually do tests and examination. But the system really failed because every single one of those interactions didn't have access to the full history, didn't have the context. We aren't really trained anymore to spend an hour with patients like you probably need to. We just simply don't have the time or the resource. So bringing these technologies in that can listen, that can condense information, that can basically improve the continuity, it's such a game changer for patients because suddenly they've got tools here as well. It's not just for clinicians. It's like a superpower for everybody in the system. And if you're a chronic disease patient, it's such a heart sink when they're like, so tell me your history. And you're like, 25 years of history. Like, please just, I used to spend 15, 20 minutes reading about every patient in my clinic for that reason. No quicker way to kill rapport than show that you haven't spent the time to learn about them. But the flip side of that is it's actually kind of impossible now. So it's going to be this sort of balancing act of how much AI can help us, how much AI helps the patient themselves, and what is it doing in the background just to make sure everybody's in the loop and staying aligned. That's why I think the real power of that lies.
Yeah, I think it's really exciting. And we'll finish off with we did touch on this a little bit earlier about what the future might hold. You talked about some of the potential of this collaboration, but what do you both see as the potential in the future for this collaboration?
Secret stuff.
Secret stuff.
Secret stuff. I don't know, Julia. How much do you want to talk about our
Well, I
dreams?
think we can talk at a high level. Yeah, well, what's in your mind, Dom? But no, the future's
Wow,
exciting.
so many things. But I think, like, okay, so at the super high level, what can you do with essentially national communications infrastructure, right? AI intelligence that spans primary and secondary care, and the ability basically for access to AI clinical quality from anywhere. I mean, that's what telephone gives you. It gives you access anywhere, right? Now, in that tool set is essentially a different healthcare system. It's a different way of accessing care. It's a different way of getting delivered. It's a different way of following up from appointments. And then, clinicians become the hub, but they don't necessarily be the bottleneck to accessing and care and moving patients forward through pathways. I think the other thing we envision and think is really important, especially in the UK, is connectivity. So TORTUS is live in secondary care hospitals. We're doing the first rollout, Devon, Great Ormond Street, and a bunch of other sites, London Ambulance Service, as well as this big sort of spine of primary care up and down the country. What happens when we start to join those two together? And actually, you start solving problems which are individual problems. So for example, GPs spend about £5,000 a month in some places paying somebody to find the actions for the patient from the GP, from the letters they receive from hospitals, and find the clinical codes. In secondary care, they are not motivated to write that stuff down in their letters because it doesn't move the needle for them. But for us, because we're in the middle, we're like, well, actually, let's create templates over here in hospitals that GPs could actually use. It would save them a bunch of time. No value over here, but tons of value over here. And it's these sort of arbitraging, like, where you can build value in the system at a real national scale. And that's what I think is most exciting about working at a national scale, is that some of the problems that are really hard to solve locally suddenly become really easy if you're literally just in two places and you're like, do me a favor, just do this. Because over here, they would really appreciate that. And actually, the regionality then becomes a really important part of how we nationalize the NHS, which to all intents and purposes is a bunch of discrete businesses at the moment, but actually could be joined up again. And I think that's one of the most exciting elements, at least from my perspective.
Yeah, very much so. I think there's there's lots to build on. The interest for us is we know we're sat on a huge amount of data as custodian. It's not our data for GPs, but there's a fantastic training set in there, and as Dom says, there's a lot of people ringing up with their issues and problems that we can know and assess and set systems up for the benefit of GPs. So having the data at scale. But the other bit then is, as Dom touched on there, is then as primary care looks to build into integrated neighbourhood teams and across the piece, there's lots we can do to help and support that integration then into the out of hours services, into the ambulance services, just to provide connectivity and give the clinicians more time to care by joining the bits up in the background. So that's the exciting bit for us, to being able to facilitate clinicians doing what they want to do and what they want to add, because there's a lot of burnout, there's a lot of frustration, from people just supplying their name, address, filling forms into a different system, etc. When all the information's held, we've just got to liberate it and move it around and empower, as you said, Harry, empower patients, move things through. So a lot of this is now becoming at our fingertips, and the real exciting bit for me as a non-techie in this space is the quality. The tech is moving on so much further that I think we can rapidly prove to people that it can be trusted. But that trust is, again, being transparent and honest about where the AI is, and setting up and following all the appropriate standards and accreditations, sharing that information, and building it in the spirit of partnership. So that's very much at heart of what we're doing, but the speed these tools are coming along and what they offer us as a society to take advantage of is tremendously exciting, and we should be doing it for the benefit of the NHS and all the patients we serve.
Well, it certainly sounds like a space to be watching. So thank you both very much for giving some insight into the background of this partnership, and thank you very much for joining and taking the time.
Thanks so much.